Secretary Keneally, Lieutenant Governor, Commissioner Burrell. Good morning. We are grateful for the exceptional effort from our healthcare system in response to the pandemic. From our hospital emergency departments, our intensive care units, to our community health centers for responding to community needs, including testing and contact tracing and everything else that a community health center does. Our healthcare system never shut down during the pandemic. In fact, they stepped up. Telehealth has reached thousands of Massachusetts residents to meet their physical and behavioral health care needs remotely, and we need for that to continue. As part of the governor's reopening plan, effective today, we are allowing high-priority preventive services, including pediatric care, immunizations, and chronic disease for high-risk patients, and urgent procedures or care that's been deferred but now at risk. Across the Commonwealth, our acute care hospital system has 30% availability for both ICU and medical surgical inpatient care. Acute care hospitals and federally qualified or hospital licensed community health centers who attest to meeting specific capacity and safety standards, such as having adequate PPE, workforce and patient screenings, may expand their services. These services are intentional to meet the needs of high-risk populations, including communities of color and our children. Expanded services include, as I said, high-priority preventive services, including pediatric care, and urgent procedures that cannot be delivered remotely and would lead to high risk or significant worsening of the patient's condition if deferred, based upon the provider's clinical judgment. Effective May 25th, other healthcare providers who can attest to meeting specific capacity and safety standards will be allowed to provide a limited set of diagnostic and treatment procedures. I cannot emphasize enough the importance of continuing telehealth. Providers should continue to maximize it and provide services virtually wherever possible and appropriate. Individuals with non-emergent needs should call their healthcare provider to determine next steps. Details of our healthcare and human services opening can be found on the mass.gov COVID-19 webpage. As we begin to reopen, we must be prepared for an increase in positive cases, for potential hotspots to occur. Expanded testing and tracing are crucial for beating back the disease. As the governor highlighted last week, to support increased testing capacity, we will submit our COVID-19 testing plan to the federal government no later than May 24th. Our future state for testing includes increasing capacity for 45,000 tests per day by the end of July, and increasing that number to 75,000 by the end of December. Our goal is to decrease our positive test rate to less than 5%. And we want to expand lab processing capacity to prepare for a potential fall surge, and to test residents and patients in high-risk congregate settings, including our skilled nursing facilities, correctional facilities, and state-operated or financed state hospitals and group homes. We want to ensure the testing capacity for individuals who are symptomatic, who are asymptomatic, and who've been in close contact with someone with COVID-19 very recently, and individuals whose employment places them at high risk of exposure to individuals who are COVID-19 positive. We will also use federal dollars to improve access and turnaround to provide for same-day or next-day results from the majority of tests. Implementing this strategy is contingent upon federal funding. Our plan is not for universal testing of everyone in the state. COVID-19 current testing options are constrained but rapidly changing, and the cost to deploy at scale is prohibitive. So our plan prepares us for the future of more economical and feasible testing options, concomitant with vigilant social distancing protocols and guidance and measured reopening strategies. That is our new normal. Once a week, we will release a public-facing dashboard, a stoplight, if you will, red, yellow, and green, of 6 indicators to note our progress, marked trending positive, in progress, or trending negative. They include what is our COVID-19 positive test rate, the number of individuals who have died from COVID-19, the number of hospitalized patients with COVID-19, our healthcare system readiness, our testing capacity, and contact tracing. The daily fact pack that many of you know will be modified a little for additional data elements, including individual hospital capacity, ICU in total, and additional long-term care data, among others. As you note, today, 2 of the indicators are green: healthcare system readiness and the decline in COVID-positive test rates. As I said, across the state, we have 30% availability for both ICU and medical surgical beds. Individual hospitals may vary, and we're only using approximately 1/3 of our current testing capacity, which is why that is also green. The others are in progress. And of course, until we only have a handful or no deaths, we can never say that we're trending positive in that area. In order to sustain the progress to date and to move us forward in the reopening of our Commonwealth, all of us must continue to be vigilant about hygiene, wearing face coverings, and engaging in social distancing. These very important public health and safety measures are our best tools at this time to protect ourselves, our coworkers, our families, and our communities. Thank you.